I'm Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is surgery after massive weight loss or bariatric surgery. This has been a wonderful development over the last 30, 40 years. Patients that just can't lose the weight, or they do it naturally, or through surgical procedures, gastric bypass, a sleeve, or other methodologies, will shed the pounds. I look at it as saying your body frame was designed to be a Porsche, but you were carrying a semi-truck load around. Now you've got rid of the semi-truck, the weight, but the flesh hangs. So now you're feeling better. You're able to wear things that you can, but some things you can't. So let's talk about what we do starting from the top to the bottom. The arms. Sometimes you get the bat wings. That's called a brachioplasty. Two ways to do it. One is the standard incision down the arm. The other is the incision in the axilla, or called the hidden or C brachioplasty. Breast. Sometimes they sag and they lose volume. Well, we can add volume with an augmentation, or we can do a lift. The tummy tuck. We usually have to do what's called extended, because the spare tire, the extra skin, goes all the way around the abdomen. When we go around the sides and we go in the back, that's called a body lift, incorporating a tummy tuck, a lateral thigh lift, and a buttocks lift. When we go to the inner thighs, we will do an inner thigh lift. That incision can be in the groin, or if the excess skin is in two dimensions, both cylindrically and coming down the side, we'll have a small incision going down the central part. Obviously, there's liposuction that we can do. We can do a knee lift. We can liposuction the knees. These are the options that are available now. I feel fortunate when I finished my training and arrived back at Loma Linda University, I started teaching these procedures to the residents back in the late 1980s and early 1990s. They have become quite common now. In addition, lastly, the buttocks. Sometimes the buttocks not only sags, but it loses its volume. We can take fat that we harvest from other areas. We can purify it, and then we inject it in the buttocks to give a nice, round, voluptuous look. We lovingly calling this taking the junk and putting it in the trunk.